Welcome to the deep dive. Today we're tackling something that's probably in a lot of homes, aspirin,
That's right, a common medicine cabinet staple.
but it poses a real hidden danger to our pets. We've been looking into some medical texts about aspirin toxicosis, specifically in cats and dogs.
Yeah, it's crucial to understand why these human meds can be so harmful to animals.
So our mission today is basically to lay out the risks, how it affects them differently, what signs to watch for, the essential stuff.
It really is striking how differently a drug like aspirin works across species. For us, it's an antipyretic, analgesic,
Right, fever reducer, pain reliever.
anti-inflammatory, even antiplatelet blood thinning. And it does all that by messing with body chemicals, prostaglandins, and thromboxanes.
Okay, so let's dig into that. Inhibiting those might sound good if your dog's, say, limping. But the way aspirin does it, it can seriously backfire in pets.
Precisely. The sources we reviewed really flagged the risk of gastric irritation, stomach issues.
Like actual bleeding.
Yes, potentially even leading to hemorrhage, especially in dogs. And if they get repeated doses, ulcers, even perforation, it's serious.
That's definitely not what you'd want if you're trying to help them feel better.
Not at all. And then there are cats. They're in a category of their own here.
How so? More vulnerable.
Much more. The texts emphasize severe liver damage, toxic hepatitis it's called, plus metabolic acidosis where their body chemistry gets dangerously acidic. Anemia, too.
Wow, toxic hepatitis.
Yeah.
That sounds incredibly serious.
Ugh.
So cats are actually affected more often than dogs then.
That's what the signalment suggests, yeah. More common in cats.
So what are the telltale signs? What should someone look out for if they think their pet might have ingested aspirin?
You really need to be observant, look for depression, just lethargy, not wanting to eat. That's anorexia.
Okay.
Vomiting is a big one, and sometimes there might even be blood in it.
Oh, wow.
Rapid breathing, tachypnea, fever or hyperthermia, muscle weakness is another sign, and uncoordinated movements, ataxia.
So sort of stumbling around.
Exactly. And sadly, it can get worse fast, progressing to coma, seizures, and potentially death, sometimes within just a day or so.
That's really frightening. And the main cause, according to the texts, it's just us, owners using human dosages.
Overwhelmingly, yes. It's usually well-intentioned owners giving human aspirin, following human guidelines, which are just completely inappropriate for pets.
An easy mistake if you don't know the danger.
Absolutely. And the why behind it, especially for cats, comes down to their basic physiology.
Our metabolism is different.
Very different. Cats have a reduced ability to process salicylate, which is the active component in aspirin. They lack sufficient amounts of a key liver enzyme, glucuronyltransferase.
So their body just can't break it down efficiently.
Right. It can't conjugate it properly for excretion. Think of it like a bottleneck in their system. Aspirin hangs around much, much longer.
What does that mean in practical terms?
It means the drug's half-life, the time it takes for half of it to leave the body, is significantly longer in cats compared to dogs, especially at higher doses, builds up, becomes toxic.
Okay. Are some pets even more at risk?
Yes. The texts mention increased risk in very young animals, older pets, and also those with low levels of albumin, a protein in the blood.
Got it. So if poisoning is suspected, how does a vet figure it out for sure?
Well, diagnosis involves ruling out other things first. Other poisons like antifreeze or rodenticides or conditions that cause similar signs like liver disease.
Makes sense. Standard differential diagnosis.
Exactly. Blood tests are key. They might show Heinz bodies, especially in cats. That's a sign of red blood cell damage.
Okay.
Also, electrolyte imbalances, anemia, low protein levels, and definitely elevated liver enzymes. Blood gas analysis is important too. You might initially see respiratory alkalosis from the rapid breathing, but that usually shifts to metabolic acidosis.
And can you test for the aspirin itself?
Yes, there are tests available to measure salicylic acid levels in the blood or urine.
Right. So let's say it is aspirin poisoning. What's the treatment plan look like? Definitely a vet visit, I assume.
Oh, absolutely. This isn't home care. Treatment requires inpatient hospitalization, almost always.
Okay.
Standard poisoning management applies. First steps are decontamination, trying to induce vomiting if it's safe and recent, or maybe gastric lavage, washing out the stomach.
Get rid of any unabsorbed drug.
Precisely. Then it's about supportive care. Correcting dehydration and those acid-base imbalances with intravenous fluids is critical. Sometimes respiratory support, like ventilation, might be needed.
What about the bleeding risk?
If there's severe bleeding, blood transfusions might be necessary. And in really severe cases, more advanced things like hemodialysis could be considered to filter the blood.
It's quite intensive. You mentioned there's no specific antidote, though.
Correct. There's no magic bullet to reverse it. Management focuses on limiting absorption and supporting the body while it eliminates the toxin.
So things like activated charcoal.
Yes, activated charcoal is often given to bind any aspirin left in the gut. And sometimes sodium bicarbonate might be used carefully, IV, to help the kidneys excrete the salicylate, but that needs really close monitoring of the body's acid-base status.
And protecting the stomach.
Definitely. Gastrointestinal protectants like sucralfate and drugs to reduce stomach acid like proton pump inhibitors or H2 blockers are usually part of the plan.
Okay, so a lot goes into treatment. What about the prognosis? The chances of pulling through?
It really hinges on a few key things. Maintaining kidney function is vital, as is getting that acid-base balance back to normal.
And what are the bad signs? Things that suggest a poor outlook.
Poor prognostic indicators would be severe acid-base disturbances that don't correct easily, significant dehydration, evidence of liver failure, bone marrow suppression, and neurological signs like coma. Those make recovery much tougher.
It really underscores the danger. So the big takeaway here is crystal clear. Human medications, even common ones like aspirin, are just not safe for pets, unless specifically prescribed by a vet. Their bodies work differently. Never give human drugs without veterinary guidance. Period.
That's the bottom line. It's just too risky. And it leads to a final thought for you, the listener.
Yeah.
Think about those subtle signs your pet might show if they got into something they shouldn't have. And maybe more importantly, what concrete steps can you take right now to make absolutely sure all medications, yours and theirs, are stored safely, completely out of reach? It could prevent a tragedy.